morning, everyone. Myself, Dr. Tejaswini. I'll be presenting about a kind of a new innovative method we have done in our hospital on it called topical application of GLYCEROL in ophthalmic procedures. So, basically, we know that corneal edema is nothing but a loss of transparency due to the accumulation of fluid in the corneal layers like epithelium and stroma, resulting in loss of transparency and causing blurred vision to the patient, and also causing a fundus visualization difficulty for the ophthalmic examination as well. So to clear the corneal edema, there are various mechanisms. One of the thing is usage of hypertonic agents like glycerol. We know that hypersol eye drops. But for the instantaneously clearing the corneal edema, we can use the glycerol. The methodology of the aim of the study, to study the efficacy of the topical application of glycerol in corneal edema. We did it's a prospective case series study. We did it on 31 patients who presented with corneal edema, where we used 3 to 4 drops of topical glycerol in their eyes, and instantaneously the corneal edema has resolved within 3 to 4 minutes, which in 30 seconds to 2 minutes, and so the cornea became clear, and we could able to see the fundus and do the further examinations. Inclusion criteria is like patients having corneal edema, and exclusion is patients having the clear cornea. Obviously, when there is a clear cornea, we don't need to put any hypertonic agent. And the patients having any corneal epithelial defect and any scarred corneas, these were excluded. So I'll be presenting this in 5 scenarios. The first scenario, then you can see in the picture in the left side, where you can see the cornea, POD1, the post-cataract surgery, to the complicated cataract surgery, the cornea was edematous and the loss of corneal transparency was there. In the post-day 1, what we did was we put a topical glycerol eye drops. The corneal edema instantaneously reduced, and we could able to see the descemet membrane detachment highlighted with the yellow arrow. So further evaluation of descemet membrane detachment can be done in the POD day 1 itself, so that we can give quickly management with the air injection can be done. So further delay of the treatment won't be happening. In scenario 2, where it was again a complicated cataract surgery, where the anterior subluxation of IOL happened, and the haptic of the IOL was rubbing the corneal endothelium, and corneal edema was happening, so obscuring the further details. So we kept in the right side of the slide, you can see we kept the topical glycerol eye drops. The cornea slightly clarity has come, and we can see just extra details like other than haptic touching the endothelium, we can see the crumpled bag and the retained cortex in the end vitreous as well. And scenario 3, patient presented with pain, redness, and corneal edema in the left side. And when we saw for the fundus examination, nothing was seen except a kind of mild haze of the disc. Nothing details were seen. So after instilling the glycerol eye drops, the corneal, you can see in the right side, the cornea became clear, and also slightly we can see the fundus as well, where we can see the pale disc, sclerosed vessels, and a hemorrhage kind of picture. So we came to a diagnosis in which the higher pressures are due to the CRVO. So by putting the topical just glycerol eye drops, we can further manage within the OPD, further not delaying the diagnosis and the treatment. That was a scenario 3. Coming to the scenario 4, it was a case of NVG, where the patient again had a corneal edema because of the raised pressures. In an NVG case, we knew that we need to do pan-retinal photocoagulation as early as possible. So when the clarity of cornea is not there itself, we will be delaying the treatment. So we can put the topical glycerol there, and in the OPD itself, the cornea gets cleared, fundus can be seen, and so that we can give a sitting of PRP. So the delay of treatment won't be there. In a vitreoretinal surgery, I am a vitreoretinal specialist, so where we had to have a proper visualization of the posterior segment. So when there is a cornea edema, we can't further proceed for the surgeries. So what we can do is intraoperatively also, we can put a 1 or 2 drops of glycerol, and the cornea gets cleared, and further we can proceed for the surgeries. This is one of the another use of topical glycerol. So coming to the discussion, hypertonic agents they usually increase osmolarity of the tear and draws out of the fluid from the cornea. And scraping of the corneal epithelium also can be done, but further it causes infection. So because glycerol is just a clearless liquid with a specific gravity of 1.26, a molecular weight of 92. It's a trihydric alcohol. Previously, it was used just to reduce the corneal edema in a case of bullous keratopathy. But what we have done in our studies, we can use it for the diagnostic and of the treatment-wise purposes. So it's a topical glycerol comes as an immediate rescue, especially in the managing conditions like descemet membrane detachment detection and allowing further treatment. And in cases like neovascular glaucoma with corneal edema due to raised IOP, which needs prompt PRP, where delaying of PRP due to corneal haze further leads to increase in VEGF drive, NVA, NVA, and rise in IOP, and this becomes a vicious cycle. And the patient might lose vision as well. So topical glycerol helps us in a quick management. So topical glycerol application is in ophthalmic procedures an innovative approach for regular practice, which is a cost-effective, safe, and instant outpatient or intraoperative procedure, facilitating better visualization of diagnosis and therapeutic purpose as well. Thank you.